The BioAfrica Digital Convention took off today under the theme Advancing Africa's Biomanufacturing Value Chains Through Innovation. Now, the aim of the convention is to spark conversation, partnerships and collaborations while stimulating the African bioeconomy. Well, what does that all mean in the South African perspective and also in a new world of COVID-19? Let's unpack this with Africa Bio President Dr. Nhlanhla Msomi, as well as Dr. Lawrence Banks, who is the Director General at the International Center for Genetic Engineering and Biotechnology. Gentlemen, a very good afternoon, and thank you for joining us this afternoon. Maybe we could start with just understanding the importance of biotechnology innovation, especially in a COVID world that we live in right now. I don't know, between the two of you, who will start with answering that broad question?
I'll take a step. We are in the midst of the COVID pandemic, and one of the facts that I lament as a biotechnology practitioner is that not many people know that the vaccines that we currently have and the vaccines that are going to be saving the world, not just for this current pandemic, but for future ones, come from the fruits of biotechnology innovation. Biotechnology covers pretty much most of what we use for healthcare purposes, as well as food. And it will play an increasingly important role in environmental remediation and climate change technologies. So in essence, when we talk about COVID-19, the solution to it is biotechnology innovation. And that is why we're meeting today to try and find solutions to work together as the global humanity to figure out how we could come up with strategies where most of humanity, if not all of humanity, has access to affordable vaccines for this pandemic and for future pandemics.
Maybe then let's find out what the Africa bioeconomy actually entails, because, you know, on the African continent, we have been consumers more than innovators. So how is this economy, the bioeconomy, being planned to work, especially in the discussions that are happening in the convention?
So
Dr. Banks, you can answer that, Dr. Banks.
Yeah, the Africa Bio Convention is really unique. It's a wonderful gathering of world leaders in biotechnology, coming from all over the world, but with one aim in common, and that is to enhance innovation and the uptake of biotechnology, not just in South Africa, but in Africa, in the continent of Africa as a whole. And it spreads the whole spectrum. It goes from the basic discoveries in biotechnology right through to making sure that these discoveries are translated into the marketplace. And I think, for me, one of the driving things about this conference is that it really believes and is really endeavouring to ensure that the products of modern biotechnology can actually be delivered to the people of Africa who really need these developments and will help to improve the quality of life.
But is it going to be easy, though, to finance this biotechnology, not only just for South Africa, in the continent? And these innovations and these programs that are going to be coming up?
I think the correct question is about appropriate strategies. Because when you say is it going to be easier or not, you are suggesting that there is a high cost that we possibly could not afford. And part of the reasons why we have a convention like BioAfrica is that if you have global solidarity and individuals from all over the globe, you are able to figure out strategies of doing innovation in a manner that is cost effective. So part of the problem we have in the world today is that innovation tends to be skewed. And so when you think about healthcare innovations that are directed to the people who can afford in the global north, and yet we have conditions that affect most of the global south, and these are much more cost-effective or affordable to do, but they're not being done because the agenda is driven by the considerations of the haves. And I think organizations like Dr. Banks' organization, whose mission is to make these innovations accessible to countries in the global south, such as Africa and other developing countries, then you start to see that it's very possible to, with a good strategy, to within a decade or so, have access to these fantastic innovations, healthcare products, even GMO seeds that are advanced. It's just a question of collaborating, South-South collaborations and strategies, because most of the technologies are now accessible. It's just how do you make the connections between individuals who need them and individuals who can contribute towards creating a solution. And I think Dr. Banks can pick up from here in terms of how the ICGB works with countries in the global south to make the dream or the reality of access to quality healthcare and to highly nutritious foods a reality.
In fact, Dr. Banks, that would be the last questions as you answered that, and must also give us an idea of what are you expecting the outcomes to be after tomorrow, the second day of the convention. What do you want to all walk away with, at least knowing going forward what will happen to the Africa bioeconomy?
So from an ICGB perspective, we have over 20 years of experience in transferring biotechnology products to countries around the world, many of them low, middle income countries, and those transfers have been extremely successful. Products such as various forms of interferon, insulins, they're all being produced at very low cost in many countries around the world for the local markets. And that is a very important point. We're not aiming here to build GlaxoSmithKline. We're not here to build massive global biopharmaceuticals. What we want to build are industries which can provide medicines at a price which is affordable for the African continent. And I think that's definitely achievable. And I think that the BioAfrica Convention is a brilliant way of bringing together all the various stakeholders in making these developments a reality for the African continent. And so for me, being at this meeting is a great opportunity to cement these collaborations, to promote the activities and the possibilities that are out there for bringing important medicines to Africa, and really very much continuing what we've been doing now for several years on the continent, expanding South-South cooperation, collaboration, all within the area of biotechnology and the agricultural sector.
Well, thank you very much for that. And I did say that was the last question, but maybe just in wrapping as short as possible, Dr. Somi, just an idea of for South Africa, how important this convention is, and has it got the support from government, Department of Health, Trade and Industry, Science and Technology, and so forth?
Thank you for that question. South Africa is one of only 2 countries in the continent that has consistently supported biotechnology innovation. the convention comes at a pivotal time to take biotechnology and to start seeing the fruits of those investments. I think we've seen over the past few hours, today's convention and tomorrow proceedings, how several South African companies and African companies are coming up with solutions, not just to COVID, but to possibly position the country in a future pandemic. Biotech is in this convention, Aspen is in this convention, Cape Bio is in this convention, and a whole lot of others. So I think the South African government has to be commended, and so should we commend the African Union with regards to supporting a continental push for us as Africans to be able to provide our own products and solutions through innovation. There's still a long way to go. It's not an easy road, but the commitment that our governments are showing and have demonstrated with real investments, with real policies that will foster this are very commendable.
Thank you very much for that. I've said we have to leave it there, but thank you for joining us and sharing all this information around this convention, and hoping, of course, those conversations and partnerships and collaborations happen at the end of this convention. Of course, that was Dr. Nhlanhla Msomi, Africa Bio President, and Dr. Lawrence Banks, International Center for Genetic Engineering